Kiitoksia edustaja McAvan. Seuraavaksi edustaja Tannock ECR:n puolesta minuutti 30 sekuntia. Olkaa hyvä.
Mr. President, Commissioners, as the fragile healthcare systems of Sierra Leone and Liberia struggle to cope with the outbreak of Ebola, we today saw the death toll tragically passing the 4,500 level. So far the number of cases beyond West Africa has been limited, and it's extremely important for strict EU-wide measures to be adopted to ensure that this remains the case. The introduction of screening processes at EU airports and border control points are a vital step, and the EU must therefore do more to encourage all member states to follow the leading examples set by France and the United Kingdom in this regard. Protecting our own shores alone, however, is insufficient, and more must be done to support efforts, including exit screening in West Africa itself. Nigeria is a clear success story to be studied, having managed to contain the virus after its first known case. This success was largely thanks to the efficient process of contact tracing that was implemented, a process which saw over 800 known contacts of the patient to be identified, traced and tested. Such work requires relatively strong institutions, efficient cooperation between them and the resources to make that happen. These are all things that sadly West Africa is largely lacking, and it's an area where the EU can be of assistance. As a British doctor, I am proud that the British Royal Navy is en route to the region as we speak, taking medical equipment, personnel and helicopters by way of assistance. With just under 200 doctors and around 2,000 nurses in Sierra Leone and Liberia combined, the two countries that is, the support from the medical contingent within that mission will be a great asset. With this in mind, it's interesting to note that there are currently 108 nurses from Sierra Leone working in the British National Health Service. And it's at times like this that we see the difficulties the countries suffering from so-called medical brain drain can face. In the longer term, it's key that the EU also continues to financially support the pharma industry to work for an effective vaccine for Ebola. Thank you.
Thank you. Next speaker, Mr. Goerens for ALDE for 2 minutes. Max.
Merci, Monsieur le Président. Si l'on veut vaincre Ebola, il faut être plus rapide que le virus et il faut l'attaquer à la racine. En Afrique, au Liberia, au Sierra Leone, en Guinée. Combien de morts faudra-t-il en Europe